Hello, have you been thinking of undergoing a breast implant surgery or a breast augmentation, but you're not sure exactly what happens in the procedure? How is it done? Is it safe? What's the recovery like? What are the complications? I'm Dr. Aniketh Venkataram, plastic surgeon at the Venkat Center for Skin, ENT and Plastic Surgery, Bangalore. And today we will talk a little bit about what exactly happens in a breast implant surgery. Now, what exactly is breast augmentation? Simply put, it's a surgery done to make the breasts bigger. There are a couple of different ways this can be done. It can be done by adding fat through what is known as fat grafting, or it can be done more commonly through something known as breast implants. This is where we use silicone based implants and put them into the breast. This is worldwide the most common type of breast augmentation. Indeed, it's the most cliched surgery in plastic surgery. When people think of plastic surgery, they think of breast implants. It's also called a boob job. Now, between these two, fat grafting is a relatively newer procedure. It's a procedure that is more suitable for very small increases in size. You can get a half or a 1 cup size increase at the most. You cannot get a bigger increase than that. Also, fat does not improve any sagging. It does not give any kind of lift because fat does not have any shape of its own. Breast implants, on the other hand, you can go as big as you want and it gives a much nicer, more pleasing shape. This is why, as of today, breast implants are still worldwide the most commonly done form of breast augmentation. Now, the obvious question is, do breast implants feel fake? Does it feel artificial? The answer is no. Breast implants have evolved through multiple generations, and the currently available implants are very natural, and we shall learn a little bit more about this in the upcoming section. Now, why undergo a breast implant surgery? What are the benefits? Well, a lot of women suffer from a lot of underconfidence, especially if they feel that their breasts are not big enough. And breast implants helps improve the self-confidence for these women. It is a wonderful surgery because it is so simple and it is very safe and effective, and it really helps people get that self-confidence. The desire for a breast implant surgery should come from within. You should not do it because someone else is telling you to do it. You should do it because you feel that this is what you need for you to get your confidence. In the right patient, this can lead to a massive improvement in how they see themselves and how they present themselves to the world. Now, who is a good candidate? A typical patient for breast implants is usually in their 20s or early 30s. They are in otherwise good health and have no major illnesses. And other than that, there is no major contraindication per se for breast implants. The only condition is we would have to check and make sure that there is no existing focus of breast cancer. So we always do screening before the procedure. This is one of the ways we evaluate the patient. We take a detailed family history and then we proceed for the procedure. Now, what are some of the planning that goes into a breast implant surgery? What are some of the decisions that need to be made? This is where it can get a little confusing. There are so many different terms. Smooth implant, rough implant, periareolar, intramammary. Let us try to simplify this and see some of the decisions that you need to make for your breast implant surgery. The first thing to decide is the incision or the route through which the breast implant surgery is done. The two most common ways it is done is one is known as periareolar, where the incision is made around the nipple. The other is inframammary, where the incision is made below the breast. These are the two most commonly used procedures worldwide. The advantage of the periareolar is that the scar is a little bit more nicely hidden because it's at the junction of the nipple and the breast skin. The disadvantage is that the chance of complications is a little bit higher through the periareolar incision. This is because you're going through the breast tissue, through the ducts that carry milk, and then going underneath the breast. So because of this, you can have more problems in terms of nipple sensation, more problems in terms of infection, more problems in terms of capsular contracture. With the inframammary incision, the incision is quite well hidden in the groove below the breast. And because you're going directly under the breast, you're not going through the breast, the chance of these complications is a little bit lower. For this reason, we prefer the inframammary incision. So that is the first decision. The next decision is about where to place the implant. Simply put, there are two options. You can either put the implant above the muscle and below the breast. So you have the skin, you have the breast tissue, then you have the pectoralis muscle. So the implant can come between the breast tissue and the pectoralis muscle, or it can come under the pectoralis muscle. These are the two options. Here again, they both have their pros and cons. We generally prefer to place it below the muscle because this makes it easier to screen for breast cancer in the future. Since there is a muscle between the implant and the breast tissue, breast cancer screening is far easier. Also, the incidence of capsular contracture is a little bit lower in the inframammary. But in some patients, being above the pectoralis muscle might be the better option, particularly in cases such as tuberous or constricted breasts. So there's no hard and fast rule that it has to be this or it has to be that. They both have the pros and cons, and you would be judged and advised accordingly what would be the better option for you. The third thing to see is whether just an implant is enough or a lift is needed at the same time. Simply put, we need to see how far the nipple is below the inframammary groove. The inframammary groove is where the breast comes and meets the chest wall. So if the nipple is very far below this, let's say 5-6 centimeters, then you can't just put an implant. What happens in that case is you have the implant and then the breast kind of falls below the implant. So you need to lift the breast up at the same time. This is an important thing to keep in mind. Some people try to compensate for this by putting huge implants and try to fill out the breast that way, but that is not a good idea. You need to put an implant that is of an appropriate size, and if needed, a breast lift needs to be done at the same time in order to get the best result. Then we come to choosing the implant itself. For choosing the implant itself, we take various measurements. Some of the measurements include the width of the breast and how thick the breast is. And based on this, we advise you on a certain range, that within this range, an implant will work well for you. Obviously, you don't want to go too small because then you might not get the result that you're looking for. But it's not a good idea to go too big either, because that has its own complications. One, obviously, it might look a little bit more artificial and look like you had a breast implant surgery done. The idea of breast implant surgery is that people who know you should be able to make out a difference, obviously. But someone seeing you for the first time should not suspect that you had this done. That's how I look at it. So, it should not go too small, you should not go too big. Also, the bigger you go, the more chance of complications such as loss of nipple sensation, etc. So we advise you on what the good range is, and within that range, we will help you decide what works best for you. This is where proper knowledge of this procedure is important. People think that breast implant is a simple surgery. Just choose an implant and you shove it inside. It is not like that. There are a lot of these fine things that need to be done in order to get a good natural result. Apart from size, the next thing to choose is the implant type. Now, most implants available today are either saline or silicone. Saline implants are implants filled with salt water. We don't prefer them because they have a short shelf life. They might last you around 10 years at the most, not more than that. So what we prefer are what are known as silicone implants. Silicone implants are made up of a material known as silicone, so they feel very soft, they feel very natural, and they are much more long lasting. Their life is almost 20 years, sometimes even longer than that. And they are very firm and durable. So a good amount of force or pressure is not going to do anything to them. Now within silicone implants, there are what are known as smooth and textured. This is an example of a textured implant, which is rough. A smooth implant is clear, it looks like glass, it is smooth. In this, we prefer to use smooth implants because the chance of a slight complication is present with rough implants. In textured implants, there has been a complication known as ALCL, which is kind of like a low-grade cancer that is found in the breast tissue many years after the surgery. Obviously, it sounds very scary, but it's not so scary. This is a very low-grade local disease. Having said that, to avoid this, we use only smooth implants. This complication has never been found till date with smooth implants. They have always been found only with textured implants. So I hope this helps to clarify the confusion on what all the different terms and decisions you need to make breast implant surgery are. Now, you might feel like this is all well and good, but is there a way that we can see how the implants would look on me? The answer is yes. We have recently partnered with a company known as Chrysalix for 3D imaging. And with this, we can show you how a particular implant would look on your body. So your photos are taken, you can even take them at home, and with those photos a 3D model is created. On these 3D models, we can simulate and show you how all commercially available implants look. And this simulation is quite accurate. The exact shape, size, and volume is available for every commercially available implant, and it can be simulated on your body to show you how it looks. Now that we have chosen our implant, we come to the surgery itself. How is the surgery done? Well, firstly, this is under general anesthesia as a daycare procedure. You come get it done, you go home the same day. There's no admission or anything. During the surgery, first the incision is made in the inframammary area. Then dissection is done. A space is dissected in the area that we want. Like in this case, it is being dissected below the muscle. Once the space is dissected, the implant is placed and it is smoothened out and put into the proper location. Then the incision is closed. It sounds very simple, right? There's not much to it. It's not a very complicated procedure. But that also means that the margin for error is a lot lower. Each step has to be done perfectly. Your implant pocket has to be millimeter precise so that it's not too left, too right, too up, too down. Your dissection has to be meticulous so that there is no bleeding. More bleeding, more chance of infection, more chance of something called capsular contracture. Your skin incision has to be perfect so that it's as less noticeable as possible. So yes, technically this is not a very complicated surgery if you were to compare it to a rhinoplasty or a facelift or an abdominoplasty. But that also means that every single thing has to be done perfectly to get a good natural result without complications. Once the surgery is done, this is what it will be like, with the implant in a pleasing shape behind the breast. Now, what is the recovery after surgery like? As I said, you go home the same day, you relax, you can move around, you don't have to be in bed rest. From the next day, you can start moving around, you can start working from home the next day itself. Within 2-3 days, you can start showering and you can even start going out. You are pretty much back to your routine in terms of your daily activities within a few days after the procedure. Now, initially, the implants might seem like they're quite higher. They might seem very full on top and a little flat below. This is because the implants take a little time to drop and fluff out into shape. So the full result, we say, can take anywhere from 6 to 12 weeks. In terms of getting back to your workout, you can start mild cardio after a week. You can start mild weights, except chest weights, after 2 to 3 weeks. You can be back to most of your routine within 4 weeks. Chest workout might take you around 6 weeks. We'll also be giving you some implant displacement exercises to help the implant sit better and feel better. Now, what are the possible complications of this surgery? Well, any surgery anywhere in the body, there can always be some complications. Any surgeon who tells you there's no chance of complications is not telling you the truth. The single worst thing which can happen is if the implant gets infected. If that happens, the implant has to come out, as simple as that. Thankfully, the chance of this happening is very, very, very rare. We do all kinds of things to prevent this from happening. We give you antibiotics. So it is very rare, but it's not zero. It's something like when you're crossing the road, you might be hit by a car. The other significant complication is something called capsular contracture. What this means is your body recognizes the implant as a foreign structure. This is true for an implant anywhere in the body. And it produces a layer of tissue called a capsule around the implant. This happens in everyone. But in some people, this capsule can become very thick and very hard. If that happens, the breast starts feeling hard, and in late stages, you might even be able to make out the outline of the implant. This is known as capsular contracture. Now, there are many theories why this happens. I have studied with Dr. Bill Adams in Dallas, who has done a lot of research on this topic, and it has been found to be related to a mild level of infection around the implant. For this reason, we take lots of precautions. We follow what is known as a 14-point plan designed by Dr. Bill Adams to reduce the chance of capsular contracture. With this 14-point plan, the chance of capsular contracture happening is very, very low. The chance is around 1 to 2%. If all of this is not done correctly, capsular contracture chances are much higher. If it's done by someone who is not well versed in the surgery, they just view it as making a pocket and putting an implant in, they might not follow all the steps and precautions, you can have a capsular contracture. So again, it's about not about just doing the surgery, it's about doing the surgery well. Now, let us look at some results. You can see here this lady, she had a mild constriction, what is known as tuberous breast in the lower area. So the implant has nicely shaped it out. And from the side view, you can see a nice fullness that is still not unnatural. Now in this patient, I want to show you this is where a lift was needed. Her breasts were a little sagging and just an implant alone wouldn't have looked good. The implant would have been on top here and the breast would have been sagging below that. So we did an implant with a lift, and lift means that there is a small vertical scar. I hope this video was informative for you and it helped you clear your doubts about various terms used in breast implant surgery. Remember, do your research. Like I said, breast implant by itself is not a very technically complicated surgery, but that also means that the room for error is a lot lower. It's not about just doing the surgery, it's about doing the surgery well. Lots of these small things are what gives you a good natural results that is long lasting and free from complications. If you like this video, do subscribe and share with your friends. Do let us know what other videos you'd like to see. Thank you. Have a great day.